Hi, I'm Dr. Milliken. After deciding to quit smoking, a large hurdle that people dread is the withdrawal. The urge to smoke and that feeling when that person has not smoked for some time can feel insurmountable. However, there are many ways that a person wishing to quit smoking can help alleviate that feeling. Nicotine replacement therapy is an easy way to curb that urge and that need to smoke. Nicotine is highly addictive, and while the end goal is to stop being dependent on the nicotine, the larger goal is decreasing and hopefully stopping the amount of toxic smoke from cigarettes that is inhaled. A way we can do this is by giving our body lower amounts of nicotine over time to curb that urge without putting the harmful effects of toxins in cigarettes into our bodies. There are many different methods of nicotine replacement therapy, including a nicotine patch, gum, lozenges, nasal spray, and inhalers. All of these options can have advantages and disadvantages, so let's go over some common options. Let's first start with a method that a lot of you have probably heard of, nicotine gum. Nicotine gum works by releasing nicotine from the gum that is absorbed through the oral mucosa. A benefit for nicotine gum is that it can be used when having those large urges to smoke due to its quicker onset. The peak of its effect usually occurs after 20 minutes and helps as a bonus with that oral fixation that some people can have when attempting to quit smoking. The gum is usually only good for about 30 minutes before having to throw it away. A common misconception about nicotine gum is that on its use, you chew it like gum. You actually don't consistently chew it. Chewing it too much, too fast, can lead to the release of too much nicotine too quickly and can cause an irritated stomach. The optimal use for this gum is a technique called chew and park. What you do is chew the gum until it has a flavor and then tuck it against the side of your cheek. You tuck it against the side of your cheek until that flavor disappears and then repeat this for a 30-minute duration. Ultimately, it's supposed to fulfill that urge for that nicotine when you have those larger urges. Similar to the nicotine gum is a nicotine lozenge. The nicotine lozenge, in a similar fashion, is used, except for you don't really chew it. The lozenge then dissolves over a 30-minute span, and this is beneficial for people with poor dentition and jaw pain. It is less likely to expel too much nicotine at once and cause an upset stomach, although an upset stomach as well as mouth irritation can occur. Less used are the options of nicotine inhalers and spray. The nicotine is delivered via vapor inhaled through either the nose with the spray or through the mouth with the inhaler. The onset is quickest with these options, however, it does come with side effects of heavy nasal irritation and possible bronchospasm. It is not generally recommended in people with a history of breathing concerns or any lung disease. Another very commonly used method for nicotine replacement therapy is a nicotine patch. The nicotine patch is used by placing a patch on a hairless area of the skin and then is simply left on for the rest of the day. It is then removed at a later time, usually 24 hours later, but can be removed at night, and is replaced by another patch, usually on another spot of the body, to mitigate any irritation of the skin. The patch is a long-acting and slow-onset method of delivering nicotine to the body, which produces relatively constant relief from withdrawal over a 24-hour period. However, the disadvantage is the user cannot adjust the dose of nicotine being released. This means you cannot increase your dose when having cravings. But not to worry, we can still treat those breakthrough cravings as well. As we have discussed, there are many options for nicotine replacement therapy, such as nicotine patches and nicotine gum. But did you know that you can take both of these at the same time? That is because the concentration of nicotine in each individual treatment is less than smoking a pack of cigarettes a day. Using a long-term patch to have a slow feed of nicotine and then using gum, lozenges, or spray for those times when cravings get a little more intense can go a long way in limiting nicotine urge or withdrawal. Another common question is, how long can you use these for? Most people will use these anywhere from a couple weeks to a couple months, and sometimes even longer. The goal is to decrease the amount of nicotine used at the user's comfort level. Remember, nicotine replacement is much safer and healthier for your body than smoking. And if needed and a relapse occurs while having a patch on, do not worry. They can be used while smoking as well. Also, it is important to keep in mind that all of these methods have different dosages, which can be adjusted due to how many cigarettes a person smokes and even for when they smoke. Discussing the optimal dose of nicotine replacement therapy with your doctor can help get the best results. There are many options that can be discussed when you decide to quit smoking. However, nicotine replacement therapy continues to be a cornerstone and an excellent tool for smoking cessation. Thank you.